epidemic began in 1988, starting the first major outbreak in Asia. Since the 1980s, an estimated 1 million has been affected by HIV/AIDS complications. As in other countries, this epidemic spread primarily through the transmission of sex. Although sex work is illegal, an undercover sex business is still prevalent in Thailand. Complicated networks of sex and HIV transmission involve sex workers, casual sex partners, husbands, and wives. Specific populations are harder hit than others, including financially vulnerable sex workers and men who have sex with men. Married women are also at risk, as unfaithful husbands frequent brothels and go home and pass the disease to their wives. Recognizing that HIV was linked closely to sex work, the government targeted this business. However, rather than taking on the futile task of shutting down all these undercover businesses, they created an alternative and more realistic program. In 1991, the 100% condom use program was established. The program aims to promote the use of condoms 100% of the time in 100% of risky sexual relations and in 100% of the sex entertainment establishments throughout the country. In other words, no condom, no sex. Reports show that condom use increased from 14% in 1989 to 90% in 1992. The annual incidence of STIs at a national level dropped more than 95%. The 100% condom use program has prevented millions of HIV infections in Thailand. This program was significant in the coordination and collaboration of different sectors, such as the government, public health workers, and sex workers and businessmen. One of the most notable government officials who worked to promote condom use and HIV/AIDS awareness was Senator Machai Viravaida, aka Mr. Condom. He used the media to change the attitude and beliefs of sexual behavior in HIV/AIDS. Machai worked to normalize the topic and teach the country that condoms are not a dirty product. Commercial sex work and a proactive government response set the tone for HIV/AIDS prevention and research in Thailand.
In 1818, the U.S. first established relations with Thailand. In 1833, the Treaty of Amity and Commerce formalized these diplomatic relations with the country. Since that time, Thailand has been a key security ally in Asia, and its stability and growth are important to maintain peace in the region. Thailand partners with the U.S. on projects relating to public health, science and technology, education, and cultural exchange. In 1958, the Southeast Asia Treaty Organization, CEDAW, Cholera Laboratory, a joint research venture between the U.S. military and the Royal Thai Army, was established to study the cholera pandemic. The organization is hosted by the Royal Thai Army and staffed by the American and Thai personnel. This organization has changed its research focus to include tropical and infectious disease in areas of military importance in the Asian Pacific region. It is now known as the Armed Forces Research Institute of Medical Sciences, or AFIRMS. In 1989, HIV-positive results were coming in from the Royal Thai Army recruits in the northern part of the country. The Thai government decided to use their pre-existing relationship with the U.S. military to collaborate with the Walter Reed Army Institute of Research, the overseeing body of AFIRMS, to isolate and study the virus. This division also studied the effects of intense education and behavioral campaigns by the Thai Public Health Ministry and Military Medicine Division. Collaboration institutes already present in the country allowed studies to be carried out according to international ethical standards. The RV144 Thai trials were specifically a collaboration between Thai scientists and the U.S. military HIV research program. There was also assistance from the NIH, Sanofi, and GSID.
RV144 has proved to be the most successful HIV vaccine trial to date. This Phase 3 trial was conducted from October 2003 to July 2006. The results were released in September 2009. The RV144 vaccine consisted of 2 parts. The first part was 4 priming injections of Alvac HIV. Alvac is derived from the canary pox virus, and this virus does not cause disease in humans and was used as a vector to deliver genes from HIV. The second part of the vaccine was 2 doses of AIDSvax, which contained a recombinant version of a protein on HIV's envelope. AIDS-Vax promoted the production of host antibodies that target this protein. A total of 16,402 volunteers were enrolled in RV144. Of these participants, 125 contracted HIV. 74 had received the placebo and 51 had received the vaccine. This means the vaccine had a 31.2% efficacy. 31.2% of course might not sound groundbreaking, but it's the best result that's been seen so far. Around 60 other vaccine candidates have been considered worldwide, and other HIV vaccine trials have been conducted. And these have seen either no change or, unfortunately, increased risk for infection. With a retrovirus like HIV, which has an extremely high mutation rate, developing a vaccine has been tricky. HIV mutates so easily and so often that the virus has a large amount of genetic diversity. This high mutation rate also means that our immune systems are unable to effectively fight it off, so we don't have good antibodies to model a vaccine after. And since it's completely unethical to try to infect people with HIV, these vaccine trials are very large and very expensive. When considering all these factors, RV144 is a pretty big success story in the fight against HIV/AIDS. And although 31.2% doesn't sound like a lot, results of this trial can help drive forward future research. Serological analysis of participants showed that the vaccine induced antibody formation against key HIV proteins. Some of these antibodies even contributed to cytotoxic T-cell responses. Analysis showed the production of immunoglobulin G, in particular, was a determinant for protection against infection. These findings are promising and they point to areas for future research.
RV144 vaccine trial results proved to be the most promising in developing an effective HIV vaccine. It's also proven that designing an effective vaccine is a challenge, as the RV144 remains the only HIV vaccine trial to demonstrate efficiency. This trial represented a major scientific breakthrough by being the first trial that a safe and effective vaccine was possible. At this point, many argued and still wondered whether it was even possible to develop an HIV vaccine after years of failing trials. Once the results of the trials were announced on the front pages of newspapers around the world, it was widely recognized by the global health community. It became the event that could be the revival of the global HIV vaccine community. It sparked and allowed for continual as well as future trials, with many noticing the possibility and success from the collaborative efforts in the Thai trial. The knowledge gained from this efficiency trial didn't just raise important questions for future vaccine developments, but it gave scientific lessons on trial design, trial implementation, and the fact that HIV vaccines are urgently needed for prevention. To also have scientific clues on immune response, it informs future clinical research by providing insights into immune mechanisms created by the RV144 regimen and additional boost effects. Following the RV144 trial, there were follow-on studies such as the RV305, RV306, and RV217. RV305 evaluates extended boosting regimen using the same vaccine components used in the RV144 to extend and increase immune response seen in the RV144. RV306 uses the RV144 vaccine regimen to compare additional vaccine boosts and gathers more immunogenicity data. The RV217, also known as the Early Capture HIV Cohort Study, or ECHO, has concluded in 2018 and was a multi-site study taking place in Thailand and East Africa. The study tracked high-risk volunteers to capture samples from different stages of HIV infection. These trials continue to look back at the RV144 trial to apply to their own current work. If lessons and scientific findings are applied correctly to future trials, it can accelerate the path to developing an effective HIV vaccine.